a spike of overdoses in Woonsocket.
When we see a pattern of increased overdose in the state, we don't just worry about it, we have to do something about it.
Department of Health Medical Director Dr. Jim McDonald says they convened a group of 70 people Tuesday, including city leaders and first responders, to talk about the city, which has seen an unusually high number of non-fatal overdoses during 8 of the last 10 weeks. This is a map that Department of Health officials use to track weekly overdose numbers. The state is divided into 11 districts. Woonsocket's threshold of overdoses is 4, and like the others, is based on historical data and population.
We keep the numbers generally the same because we're trying to get the numbers to 0. So if we were to elevate the numbers, we'd be accepting that bad things are happening. At the Department of Health, we don't accept that bad things will happen. We try to stop bad things from happening.
Rhode Island hospitals are required to let the state know about overdoses they treat within 48 hours.
It really has allowed us to have a close to real-time response to an emerging epidemic.
Epidemiologist Megan McCormick and her team review the data each week, and if a district exceeds its threshold, it'll receive what's called a ROAR, or Rhode Island Overdose Action Area Response Alerts.
We typically send 1 to 2 alerts a week. Probably once a month we have a week that we don't have an alert going out anywhere in the state, but on a given week we usually are sending an alert to at least one community.
The alerts and data allow the state to track the opioid epidemic and inform communities about trends in close to real time, a technique the department says other states are now replicating.
In many ways we have been on the forefront of our response. Really being able to get the data at the local level in a very quick time frame to our community partners is very unique to Rhode Island.
And I think this is the trend for the future. You know, public health has to be responsive, has to be agile, and has to move quickly. And because really the people in our community don't want to read about what happened a year from now in some stodgy textbook. What city leaders and community leaders want to know is what happened last week and what can we do to prevent tomorrow from being a worse day than yesterday.